say as little as possible. I've had a horrible virus and my voice sometimes starts going all croaky. So I'm just going to hand over to Debt. We're delighted that she's been able to join us today. She's one of the few people in the country, indeed one of the few people in the world, who's interested in spirituality and nutrition. She's a reader in nutrition
and spiritual health, yes.
And spiritual health at Coventry University. And we're really grateful to her for making the journey across the country to come and be with us. Thank you, Deb.
Thank you. Great. Hi, everyone. So, yes, you're all very quiet. It doesn't have to be too formal. So, you know, if I talk, if you have comments, then that's fine. We can have a discussion as we go along as well. So, you know, don't stand on ceremony or anything. So, what I'm going to do really is just give you a little bit of background into where does kind of God and religion fit into the field of particularly obesity and thinking about nutrition and sort of dietary related diseases. So I'm going to sort of take you on a bit of a journey where the evidence has got us, where we're kind of thinking of going next, and what we're doing at Coventry University to kind of advance this field. So that's really where I'm going with it. So I'm sure I don't need to tell you any of this information, but we all know that obesity is a global health problem, and the reasons for it are, one, the absolute magnitude of the rate at which obesity is growing. So 60% of the world's population is actually projected to be obese by 2030. So that's obviously a huge thing. And we know that obesity obviously increases the risk of non-communicable diseases, cardiovascular disease, cancer, diabetes, that sort of thing. But it's also significantly associated with poor mental well-being. And there's a bidirectional relationship between obesity and depression. So as well as obesity, kind of studies show that obesity leads to depression, also depression leads to obesity as well. And I think very much, and you'll kind of get a feel for sort of where I'm coming from in terms of my opinion on these things. But I think the public health agenda has very much tried to kind of, in a good way, it's tried to sort of solve the problem, but by doing so, it's kind of pressurised a lot of people to try and achieve a healthy weight at the expense of everything else, and really has, I think, to some extent ignored the mental health and the well-being of those who are struggling with weight loss. And I'll go on and explain that a little bit more. You know, simplistically, you could say, well, to lose weight, all you have to do is eat less and exercise more. And that is, if any of you have tried to lose weight, you know that might be what you're told, but actually it's not as easy as that. And the Foresight report was a good report, in the UK government report, that showed all the things that actually have an impact on why people develop, gain weight. And that's not only to do with just sort of what somebody eats and how much exercise they do, although that's the core of it, but it's all those influences that lead to somebody ending up having, taking in more energy than they're using up. So we have what we call obesogenic environments, where, you know, there's food everywhere, you can see it, you can smell it, you always want it, whether you need it or not, just because it's available. We have, you know, the environment that tends to mean that our lives are quite sedentary in terms of, you know, we jump in the car and go everywhere, and just even that might be that it's not safe to walk in certain areas. So there's lots of reasons that kind of lead us to that sort of imbalance in the energy equation. And there's things at a society level. So obviously the environment is at a bigger level than the individual. But there's also the kind of psychology at society level, you know, what the media portrays, and the kind of culture of sort of what we're supposed to eat. And then there's the sort of individual level of the sort of psychology as well. So how kind of an individual's mental state will actually influence how much they eat and what they eat, and I'll come on to that in a little bit further. So obesity has been shown to have all these kind of different factors leading to it, but what hasn't really been addressed, and what I'm kind of pushing forward, is the thought about, well, what is the spiritual, are there any spiritual causes and consequences as a result of this? And if so, then kind of what is the role of the faith community, and what is the role of the church in kind of dealing with those things? So that's a little bit of background on obesity itself. Again, you're probably quite familiar with this, having come into a seminar about religion and health, you'll probably know this. But overall, systematic review evidence shows that religion is associated with reduced all-cause mortality, reduced cardiovascular disease, better well-being and happiness, less depression, increased recovery from depression, and perhaps some lower risk of cancer. Now that's huge brushstrokes. It's not quite as simplistic as that, because there are studies that are inconsistent and don't kind of show it all being a positive relationship. And I'll come on to that a little bit more when I talk about its kind of benefits and negative impact on obesity. But that's kind of the kind of broad brushstrokes of what the evidence is showing at the moment, that religion can have this positive impact. And the reason behind that, lots of different explanations, but certainly a lot of the non-communicable diseases, so thinking about things that have a lifestyle element, it might be to do with certain lifestyle factors being prohibited within certain religions. Religious people tend to smoke less, that kind of thing. But then what's more interesting really is the aspect about spiritual and religious coping, and the impact that that might have on stress, and stress being that one of the mediating factors for a lot of those diseases. And also some of the reasons it's thought to be beneficial is because of the social support within faith communities as well. But all the evidence that we have so far isn't enough to kind of say religion is good for you. It's kind of much more complicated than that. And there's inconsistencies with the evidence, and also the evidence, the way it isn't enough to actually prove cause and effect. So, and you can only really do that by kind of running an experiment and testing a hypothesis and doing a big kind of clinical trial where you kind of randomise people to religion or not. And that has its issues, but we'll come on to that a little bit later. So that's the kind of general background, which I'm sure you're familiar with. But what I really want to focus on is obviously the relationship between religion and BMI, or body mass index. And body mass index is where your BMI is over 30 is where you'd be classified as obese, where your BMI is over 25, you'd be overweight. And BMI is worked out as your weight divided by your height squared, basically. So the overview of the evidence from 36 studies in this area has shown that the not large majority, but nearly 40% actually show that religion is associated with a higher body weight. So that is quite a negative thing to think about, that actually if you're religious, then you have a higher body weight. But there's also been almost as many studies that have found no association between, religion just doesn't have an impact on your body weight. And then some studies show that religion actually, the more religious actually have a lower body weight. So when you kind of have all this inconsistency, you're kind of thinking, well, what's going on? And it can be quite confusing.
Well, there's 36 studies looking at different religious groups, like a religious group each, or are they looking across the board at lots of different religious groups?
They a mix. So most of the studies have probably been done in kind of Christian populations in America. So that's where most of the evidence is coming from. But some of them are, I'll show you the one that I did, which has got a mix in a moment. So, but the key thing is that obviously when you're just looking at an association, you don't know, you can't prove that it's religion that's making people overweight, or it might be that actually those who are more religious are going into, or those who are overweight are going into faith communities to get more support. There's sort of different ways. So with these studies that are just cross-sectional and looking at one point in time, you can't actually, determine what comes first. A bit like a chicken and egg, you can't sort of determine that. And the studies that have looked at, how religious are people and have followed them over time to see how much weight they gain, they have tended to show that there really isn't the same association. So we're quite at a point of sort of it just being unclear and inconsistent in terms of the impact of religion and body weight. But most people lean towards the understanding that religion and an increased body weight are associated. That's kind of the sort of general feel. If you talk to people, that's what they will sort of suggest is going on. And then I did a study in England for the Health Survey for England data, just to explore whether this relationship existed here, and found that those who were associated with a religion did have almost a point increase in BMI than those who weren't associated with a religion. And we did actually split that up across religions. The problem with doing that was most of the people that we had in a representative sample, just because it wasn't a huge sample, I think it was about 7,000, were kind of nominally or sort of reporting that they were from a Christian or a Catholic background. So although we did see that those who were associated with the Buddhist faith actually had a lower BMI, that was only a sample of about 35 people out of the whole lot. So it's quite hard to kind of unpick that different sort of religious association. But overall, sort of where you're looking at the strongest evidence because of the size, certainly you could say that religious affiliation to Christian and including the Catholic a part of Christianity is associated with a higher BMI. And one of the reasons that it's thought to have an impact, and one of the reasons that perhaps has been thought to explain why people who are overweight or who are more religious are more overweight, is because if we have people who are more religious, also those people who smoke less, which the evidence shows that happens, then smoking tends to keep your weight down, it suppresses your appetite, increases your metabolic rate. So in some studies that has completely explained away that relationship. And so we adjusted for that in this study, but found that there was still some effect there that wasn't explained by things like weight, like smoking and alcohol intake. So there's something going on which we don't know about. Also, again, it was just a cross-sectional study, so we don't know kind of what's come first. Now, perhaps the most, actually I've probably said all this, so just some of the reasons why we've thought about why weight might be associated more, and religion might be positively associated. There is thought, like I say, about the smoking. It might be, when you look at all the inconsistencies of the evidence, that really we're barking up the wrong tree and there is no association, and we have to bear that in mind. It might be, we don't know which way round the relationship goes, so I've said that already. And then the other thought is, well, actually, if people who are in religious groups are kind of, not smoking, not drinking, then the only thing left as their kind of release is eating, and are they kind of overindulging because that's not frowned upon within the religious community, and food is kind of celebrated. So these are some of the ideas that have come about to try and explain these things. But what I think is most interesting is actually that when you look at these studies, it's the way that they measure religion. And religion if it's measured as a kind of affiliation, or where somebody just kind of ticks a box and says, yes, I'm a Christian, or yes, I belong to this faith, but it doesn't kind of ask about the importance of religion in their life, or their kind of intrinsic religiosity rather than just the nominal religiosity, we get quite different results. And an interesting study was done in the Australian population, which showed that those who were affiliated to a religion had a higher BMI, like we found in America and England and lots of the other studies. But what they did was they also measured kind of the importance of religion to people. And where religion was more important and people were more kind of engaged on a deeper level with religion, then actually the opposite was true, and there was a lower BMI associated with that intrinsic religiosity. So that is what I find quite interesting, that what is going on that actually means that somebody who is perhaps more engaged and perhaps getting more of a sort of benefit from their religion, that can actually have a positive impact on their weight, and why is that? So that's the kind of things that I'm starting to explore. So from what I've kind of presented so far, I'd say that there's really sort of two key messages from the evidence that we have. The first one is that if actually those who are more religious are going to be those who have a higher body weight, then does that mean that faith communities and health promotion should be done within faith communities, and that churches and other faiths should have a health ministry, and would that be a good thing to actually help with the global problem of obesity? So that's one thing that I think comes out of the evidence so far, that if BMI is actually positively associated with religion, then surely that means that there's a target population there that might need more help in terms of dealing with this issue than the rest of the population. So that's one thing to kind of think about. And this has been taken up by the World Health Organization. This is actually quite old now, so this was in 2009. And they, in their global strategy on diet and physical activity and health, actually had a section there which they were talking about interventions within religious settings as being an important part of the whole way to tackle the kind of obesity epidemic. And that was came about from the evidence that was done in America in lots of African American churches that actually had health promotion interventions, weight management interventions, which were really successful for a community that wouldn't necessarily be accessing the healthcare without it being in their faith group. So that's led it to be kind of legitimately recognised, really. And then also in England, if you look at the Public Health England documents, there again has been specific mention of faith-based organisations having a role in health promotion and managing obesity in that way, but really in the kind of health promotion aspects, and thinking that actually if you're kind of doing health promotion within faith settings, you are reaching perhaps a hard to reach group in some places where they're more likely to go to their religious community for support and help than they are to go to the doctor. So that's the kind of thinking behind that. And I don't know if you've heard of Faith Action, but that is an all-party parliamentary group which its role is really to raise the profile of what faith communities are doing within the kind of the role in society, and one of those things is what are they doing for the health of the nation. So there was a report written about that. If you're interested, it's the Faith Health website. The other thing that makes it very interesting to kind of people at policy level is that obviously you've got faith communities, and a lot of faith communities you've actually got people who work really hard in a volunteer capacity. So when you're thinking about how strapped the NHS is for cash, you're thinking that actually the NHS is pushing everything into the community to try and kind of, you know, make sure that we're sort of using resources wisely, then it's suddenly become very attractive that community settings and faith groups who have this kind of volunteer workforce that can be mobilised to help with health promotion and to help with help kind of build resilience within the community and people coping with disease has become very attractive to policymakers. So that's another kind of aspect of sort of where it's being viewed as at a policy level. And, you know, for somebody who's trying to do research in that area and get funding for the research, it's quite helpful that I can pull in those documents and say, well, actually, you know, this is what WHO says, this is what Public Health England say, because it kind of, you know, builds the case. The second message I want to sort of present to you really from these findings is what's much more interesting to me, and it's about that intrinsic religiosity. So if we think that if somebody is kind of more engaged and finding a benefit from their religious experience, their walk in their faith, then that might actually have something which can be used to help with the problems of not only weight control, but particularly that sort of poor mental well-being within people who struggle with weight in the long term. So I think out of this we can think, well, spiritual and religious well-being may influence the ability to control body weight, and if it does, then you know, if we think about the concept of kind of religiosity and intrinsic religiosity as being kind of religious or spiritual well-being, then if somebody is kind of in a place of spiritual well-being where their sort of faith walk is going well, you know, they're not sort of conflicted between what's going on in their life and their beliefs and that sort of thing. So they're in a place of kind of spiritual peace, if you like, then that is something that seems to be able to help people to kind of control what they're eating better, and I'll show you the evidence for that in a minute. But having said that, it means that if somebody is kind of in a place of spiritual struggle, then also it might be that as their coping mechanism, they're turning to food. And again, I'll show you some of the evidence around that. So what I would put to you then from this is that if kind of spiritual health has this impact on eating, then surely within kind of interventions that are to help with people who are struggling with food, they're struggling in their relationship with food, they're struggling to control their weight, then should we be thinking about also incorporating a spiritual solution for those people where it's coming out of a spiritual sort of struggle. So that's kind of what I'm working on at the moment. The other thing that I would suggest, and I kind of suggested at the beginning, is that I think we need to move in society from thinking about obesity in terms of, you know, just a problem which has to be solved by losing weight, because that's been tried for years and years and it's just not working. To think about actually obesity is really a relapsing and remitting disease. And so how can we reduce harm within the obese population for best health outcomes and focus on that without banging you know, people over the head saying, well, you know, you've got to keep all those kilos off and that's all that matters. Because that isn't all that matters, and what we're doing is we're actually driving people into a state of poor emotional well-being because of it. So that's the kind of take that I'm sort of bringing to this, and I think that fits very well in terms of spiritual and religious well-being, in terms of helping people to kind of deal with guilt and to become free and cope in life with things, rather than pressurising them to a negative effect. I'll explain a bit more about that in a moment. So I said I'd present some of the evidence, just so you know it's just not my ideas, but it is actually based on the evidence that's out there. So there are studies that show an inverse association between spiritual well-being and emotional eating. So those who are measured on the scale of spiritual well-being, those who have better spiritual well-being tend to also be those who are less emotionally eating, for emotional reasons. Very recently this year, there was a study that was done by Julie Etzlein, which actually, she's developed a lot in America. She's developed scales of anger to God and scales about spiritual struggles. And she has found that there's an association between binge eating and anger to God. So again, that is there suggesting that when somebody is in a spiritual struggle, then one of their coping mechanisms might be food. So that's sort of bringing the evidence in there. Also, we can see that spiritual well-being has been positively associated with improving quality of life and self-esteem among patients in weight management clinics. So it's where this kind of a spiritual aspect has been looked at, it does seem to be kind of having some beneficial effect over not exploring it at all. And again, qualitative studies show that where increased internal locus of control, increased self-efficacy, people feeling much more in control of things, where they are kind of bringing God into their eating, if you like. And then even among those who are not religious, there is an openness to incorporate a spiritual aspect into eating problems. And you'll all have heard of Alcoholics Anonymous. Don't know if you've also heard of Overeaters Anonymous, but that's along the same sort of principles. So that's where that research comes from. But to prove that addressing spiritual well-being is an effective strategy, we can't just talk about it. We can't just say, well, there's this association, there's that association. We have to actually do an intervention and see whether it makes a difference. And ideally, we have to have an intervention and compare it to a control intervention without a spiritual element and see what the difference is. So we need to have good kind of clinical trials for that. And none have been done in the UK until I began my work in this area. And I've just completed a feasibility study looking at a spiritual, a holistic intervention. So it had all the other aspects to it, but also had a spiritual aspect to it as well. And I'll share some of the results for that in a moment. So the protocol for that is published in Religions, and the results for that are also under review. And at the moment, we're going into a phase 2 of developing that programme, so that we can start to have a proper randomised controlled trial in that area. Because for those of you who understand about the sort of hierarchy in clinical evidence, nobody will take any notice of anything unless you have a randomised controlled trial. So that's kind of where I'm going with this. Because for notice to be taken, we have to prove efficacy. Yeah.
Is it possible to ask about how that need for RCT-based evidence, how is that supposed to relate to a context of health and existence within health that is the height of non-empirical?
Yeah,
right? The demand for something there seems to be conspicuously at odds with the problem itself as being understood. Have I missed something here, or
no? I think it's. I think there are. there are really polarised views in terms of, you've got, okay, so spiritual things, how can you measure that empirically? And then you've got kind of clinical measures, you can't measure it other than empirically.
Sure.
So there is that, but I would put to you that where we need to go in this field is actually to not prove kind of God with science, because you can't do that, but prove the impact of engagement with religion on clinical outcomes. And that's kind of where I come at it.
Thank you.
So I'll just go through what one of the program that I've just done a feasibility trial in, so that you can kind of get a feel for what this would look like on the ground and what I'm trying to do. So I developed a program called Taste and See. Anybody know where that might have come from? Taste and See?
Rubber sounds?
Yeah, so it's got a bit of a three-pronged thing to it. So the reason Taste and See, one is because that's a biblical reference. Two, because actually this is about a compassionate approach to people who are struggling with weight. It's not about saying you have to go on a diet, you have to restrict your food and be miserable. It's about actually getting into a healthier relationship with food, tasting and seeing that the food is good, as well as taste and see that God is good. And then it's also about, well, actually tasting and seeing, because we're doing this research we don't know yet. So that's the kind of three-pronged approach to it. So a church-based program to develop a healthy relationship with food. So I've not called it a weight loss program, because I firmly think that if we get people into a place of holistic well-being, where they're not turning to food for comfort, then weight loss will follow without you having to kind of push it at the forefront. And that's part of a kind of, there is evidence around that, which I'll show you in a moment as well. So the theory of this intervention is basically about addressing the problem of dietary restriction leading to kind of an unsustainable way in which you just can't live your life. If any of you have been on a diet, then you'll know that if you try and restrict something, or you say, I can't have it, you want it more than you've ever wanted it before, and you dream about it. So it's that kind of, the forbidden fruit sort of thing that can be quite difficult. So dietary restriction means that it can be very hard to sustain, and the more severe the dietary restriction can sometimes mean the harder it is to cope with that. There are caveats to that in terms of what diets that put you into ketoacidosis and ketogenic diets, but that's kind of not where we're going at. We're looking at things much more at a sort of normal level rather than a clinical type diet. So, and then when things are difficult to sustain, people often feel a lot of guilt, a lot of shame that actually they've not managed to stick to their diet, they feel they're stupid, they feel they've got no willpower, and then they end up feeling pretty miserable with themselves. So because they're feeling so miserable, they give up and they eat even more, and then because they eat even more, eventually they think, oh, I'm putting on weight, I have to go on a diet, and it goes round and round and round and round. And that's the kind of yo-yo dieting cycle that you can see it documented within the psychology literature, but certainly for years of clinical practice in helping people who are struggling with their weight, you see it all the time. So that is the problem that leads to such poor mental health really within the obese population. And it's that problem that we're trying to address with this intervention. And the first way to address it is looking at an intuitive eating approach. So this is where instead of saying to somebody, you have to restrict all that, you can't eat this, you can't eat that, you're actually saying, well, step back a bit, just allow yourself what you want, but instead of focusing on restriction, just start to listen to how hungry you are, how full you are. Stop when you're full, eat when you're hungry, get to know those sort of systems in your body again. Lots of people have who struggle with their weight don't really know what it's like to feel hungry. And so it's kind of developing a freedom to eat, but in response to physiological hunger. And the thought is that once you do that, you're then getting into a place where you're self-acceptance and better body image, because you're finding that your body is working for you. You're starting to listen to those signals and find that helps. And with that kind of freedom in terms of eating, and with just kind of listening to your body, you can find that if you're told, well, actually, you can eat anything, you just know whether you're hungry or not, then suddenly all the things that you thought you couldn't eat, that you can eat, just that issue is gone. So it's about kind of releasing people into that sort of freedom, where people eat for physiological reasons as well, rather than emotional reasons. So these kind of 4 concepts are what's known in the literature as intuitive eating. And it's quite a controversial topic, because there is fear that if you let people eat what they like, then they're going to put on weight. But we've just done a systematic review looking at intuitive eating versus conventional approaches to weight loss. And you actually find that, yes, in the short term, those who are restricting lose weight quite quickly. But in the long term, really there's no difference, because there's so much weight regain. But what happens in this intuitive eating is people are much happier. There's much better sense of weight-related quality of life and mental well-being. And then what I'm doing within this church-based program is adding to the intuitive eating the spiritual elements. And so thinking about this is a church-based intervention, so this is using Christian principles. So where you kind of thinking about intuitive eating, it's marrying it up with sort of a Christian principle of freedom, and then also saying, well, yes, you can be free, but be responsible with it. So that's the kind of responsibility of eating in tune with your body. And then where you've got things like poor body image and things, this program talks about love, forgiveness and acceptance by God. And then where you've got issues of sort of emotional eating, it's about building people's resilience, and also if those people have a faith where they are able to kind of draw on that for help, then it encourages that. So that's the kind of spiritual aspect that's added on to the intuitive eating to try and solve the problem. So the principles are really that it's more about addressing wholeness than about addressing weight and just looking to the scales to kind of show that you're lighter. It's more about mental well-being, spiritual well-being. It's about reducing diet and weight-related guilt, which is a huge problem. And the focus isn't on weight, but it's allowing weight to follow as the relationship with food improves. So like I said before, it's more about harm reduction in a chronic relapsing and remitting disease, and the focus is really on improving weight-related quality of life. And we have measures of quality of life, but there are measures specifically of weight-related quality of life, and that includes things like stigma within society and all sorts of things. So what this program is, it's sort of about 10 sessions. It presents the scientific evidence. For example, it will tell you how scientifically appetite control works, how neurologically appetite works, but it also presents a biblical view. So it will kind of present, well, you're created in the image of God, so it does this from a Christian perspective, and then so there's kind of talks which we've now put on DVD to give that sort of content, and then groups are encouraged to discuss what that means for them and to set goals for the week ahead. They're also given kind of Bible readings that they can do throughout the week. And where this is really unique compared to anything else that's been done before is that it's combining intuitive eating with Christian principles. There's been lots of studies in the US, like I said, in the African American churches, that have done weight loss interventions, but they've still been very much focused on this dietary restriction. And I think that this is a much more compassionate approach and fits very well with the sort of compassionate teaching of the church. So the methods I'll just go through for what this particular feasibility was. So as a start off, all we've done is measured kind of so to have data before people start, data when they've finished, and 6-month follow-up data to see what the changes are in weight, in spiritual health, in mental health. We had 18 participants. This was just done in one church, all who were overweight, but really the average was they were in the obese category. Obviously we got ethical approval. For those of you who are interested, we analysed the results as intention to treat analysis. So we didn't just say, well, those who stuck with it, we used their data, which looked good. Those who dropped out, we kind of, did the worst case scenario so that we can say, well, actually, we've not kind of manipulated this. And then within that, in terms of understanding how participants engaged with it, we also did a qualitative study there as well. So because it was feasibility, we just want to see, could you do this kind of thing within the church? Because it's not the usual environment for doing kind of clinical research. So we found that the best recruitment method was kind of people just telling their neighbours about it, telling their friends about it. We did have quite a homogeneous sample. Most of them were white, middle-aged Christian women who were well educated, but that's really kind of reflected the area that the church was in. But it's important to do that. So we had 18 people, only one of them dropped out, which was quite good. But not everybody attended all the sessions because they had prior commitments and things like that. And then the other thing that's particularly important to know is that we trained people within the church to deliver this, to kind of facilitate the group discussion. So it's not run by a healthcare professional. The materials are there that can be used and can be presented, but the idea is that it's led by churches and run by people who know their congregation and can support in that way. So the people who are running it are not teaching it, they're not advising people because all that material is there, but they're kind of facilitating the discussion. They're helping people find their own solutions for what will work for them. So we did find that mental well-being, anxiety, depression, quality of life, particularly the pain discomfort area of quality of life and the EQ5D, uncontrolled eating, emotional eating, cognitive restrained eating, intuitive eating, BMI, all those things had significantly changed for the better in the first 3 months. We also saw improvements in spiritual well-being and reductions in energy, fat and saturated fat intake, but it's such a small sample size, we weren't really expecting statistical significance, so the fact that we did get it in those other things was pretty good. And then at 6 months, because we followed people up again, we found that there was still significant improvements seen in mental well-being, less anxiety, people eating more intuitively, people not eating so uncontrollably, not eating so emotionally, and then non-significant improvements we found in still in weight and total energy and fat intake. So really it's been quite positive results that we've felt we've had there, and that's just those, but all this will be in the paper that comes out soon. The other thing we looked at is particularly wanted to see, well, how was those differences that we found, how did they work in terms of changes in spiritual health? Was spiritual health changing actually a factor in some of these changes? And we found that where people had a reduction in their kind of avoidance of God, a measure of avoidant attachment to God, that was actually associated with a decrease on anxiety scale and also an increase in their quality of life scale. So we did find some of those things, but the sample size was very small. And then qualitatively, what the people thought about it was that they felt that the kind of intuitive eating side of things, where we were encouraging people to eat more freely, they found it was a challenge. Yeah, you can see there. That was a quote. It was like, you're just telling us we can go and empty Tesco's. Obviously we weren't, but that was how they perceived it. So that was their very initial reaction. They were quite worried and sceptical about it. But then, as they went through the course, they found that actually it was teaching them to be more responsible. They really wanted to be told what to do. They really wanted to be told, you can't eat that, you can't eat that, you can't eat that, because that's what they're used to. But when we said, no, we're not telling you that, they were like, oh. But then they started to find the solutions for themselves, and they felt a sense of empowerment with that. And then with that empowerment, certainly by the end, we were seeing that people were feeling that much less guilty about eating. People could enjoy a cake, enjoy a chocolate bar, and not feel guilty. So that was the sort of intuitive eating aspect, some of the responses we got from that. Then in terms of the spiritual engagement, I think probably the most novel finding was that we found that so most of these people were members of a church who were engaged with the Christian faith, and they had struggled with weight problems all their life, and they had never talked to God about it. They talked to God about everything else, but never about their weight. And there were several kind of reasons came out for that. One was they thought, well, God won't care, it's too trivial. But probably when you look deeper, what it was as well, they felt quite ashamed about it. And they were like, well, I've got a good relationship with God, but I've got such a bad relationship with food, I just can't bring the two together. And that was quite an interesting finding. And then as they went through the course, there was that realisation that actually God did care about this part of their lives. And they felt that as they understood that God cared about them, that they could bring that to God. And with the sense of kind of understanding that God wanted to help them in this area, that gave them a new motivation to change and to do something, so that they were kind of much more, much less conflicted about their food and their faith, and kind of going in the same direction, which was what we saw. But this is just a tiny glimpse, really. Again, the qualitative results will be coming out shortly, hopefully. So in conclusion of what the study found, was we found that it was feasible to recruit, to train church volunteers, to be facilitators, and to evaluate that in a church setting. Mainly positive association we found in the outcomes, but it was very small, so we can't really sort of draw much from it, and we need a larger study, which we're going to go on and do. So, and it did suggest that people, welcomed this kind of spiritual aspect, although at the beginning we found it quite hard. So we're now going to go on and do a cluster RCT, and what we're going to do, because it's very hard to do a control group, so we're actually going to have a kind of a waitlist control where we're going to try and randomise people to doing the intervention straight away, or kind of recording the data and doing it sort of 3 months later. But if I've got time, I'll just give you a bit of a taster of what this might look like. So this is a taster of kind of where we're going with it. But it's not something that I'll probably have to take this clip off. Actually, if we're filming it, it probably isn't something we can, because it's not being, if we just do kind of get the trial started in the new year with churches around the country kind of taking part. So that's really the sort of main area of the work that I've been doing. and I haven't been doing it all alone, although I have the privilege of standing up here and telling you about it. So this lady here, it's touchscreen. How cool. This lady here, Ria, has done all the analysis on that taste and see as part of her PhD, and helped collect all the data when we ran that programme. So she's been instrumental in getting things to where we are now. And then I won't go, time's running out, so I won't go through everything, but I've also got other PhD students who are looking at other aspects of kind of spiritual and religious things in terms of nutrition, dietetics, and that sort of thing. So Steve here, he's actually looking at how you develop spiritual competencies for dietitians in clinical practice. So bearing in mind all that I've said about actually there is a spiritual aspect to eating, how do we address that in clinical practice, and how do we train our students to do that? So that's what he's looking at. He'll be doing some feasibility studies in it. He's actually developing a board game to try and get people to sit around and kind of discuss things that are really quite taboo. So that's what he's doing. And then Alex, she is working in food banks, and she's done an intervention within food banks of kind of trying to help clients in food banks, instead of just being given a package of food, to actually know what to do with it and use it. And out of that, she's developing, or she's seen that there's a more than food approach. So again, it's not just about the food, it's about everything else. It's about signposting people to all the other things that they need, citizens advice, that kind of thing. And she's taking that further now. So that was the first phase, but now she's taking it in terms of a more than food approach within the NHS, in terms of dietetic practice and in terms of dietetic consultations. So she'll be trialling a brief spiritual intervention, which is basically within dietetic clinics, getting people to do a brief assessment of whether there's a spiritual crisis, and then referring people on to chaplaincy or to their faith groups, depending what the findings are. So she'll be doing a trial in that. So she's just about to go into her second phase in her PhD. And then Chantel is in her second phase, and she's working in Seventh-day Adventist churches, and she's trying to pull into the UK some of the stuff that has been done in the States in terms of an intervention within the Seventh-day Adventist church that will help particularly Afro-Caribbeans, certainly in Coventry community, who really don't access healthcare that well, have got a higher risk of diabetes, but will actually go to the church and listen to the advice in the church. So she's doing a health needs assessment at the moment, and then developing an intervention modelled on what they do in America. So that's my little team of who does what, and these are just some of their, so this is Alex in terms of more than food in the church setting. Next, and then she's going to do that in the NHS, and that's Chantel with her Seventh-day, that's the little Seventh-day Adventist church in Coventry. And then the other thing that we're doing in Coventry is in 2018 we'll be hosting the European Conference on Religion, Spirituality and Health. And in the previous years we've taken lots of our students, and in fact some of those PhD students got their interest from going to that conference. And that's all I was going to say. So there you go.